Director Derrick, thank you for joining us at the Right on Crime Studios. Hoping you can share a little bit about your background and how you became the director for Idaho's Department of Corrections.
Yes, well, thank you for having me, Molly. I'm happy to be here. So I've been serving as the director for the Department of Correction for about 1 year now. And before that, I served as the deputy director for 6 years. But I began my career over 20 years ago in the Rhode Island Department of Corrections. And I've been in corrections for, I think about 23, 24 years now in total.
Great. As the director for one of Idaho's largest state agencies, can you give us an idea of the size and the scope of this agency?
Yes, we have a very large footprint in Idaho. So people think about the Department of Correction and they think prisons. And we are prisons, and we have 10 state prisons. We have 5 community reentry centers, but we also have 7 districts for probation and parole supervision across the state. So we have a footprint that is statewide. We have about 2,200 employees who staff all of those operations, and we're responsible in total for about 10,000 prisoners and about 15 to 16,000 people on felony supervision. So very big footprint in the state.
Wow, that is a large agency and a large footprint. You really touch every corner of this state. That's impressive. My background is in corporate banking. Mm-hmm. I spent about 25 years doing that. And I can tell you, from talking with lots of banking professionals, lots of business professionals, I would say general public, the majority of us, I don't think, realize that we have a high incarceration rate in Idaho. Can you share with us some of the facts or some of the statistics around Idaho's incarceration?
Sure. So when we talk about incarceration rates, we're just talking about the number of people incarcerated divided essentially by the population, right? And so we're trying to get to an apples to apples comparison across states. Idaho is fairly high on the list of total incarceration. And I think the statistic that stands out the most is that for women's incarceration, we currently top the charts in the U.S., so higher than all of our neighbors and in all other states. Sometimes I think when you talk in terms of incarceration rates, things get a little bit lost. So in real numbers, what we're talking about is, again, we have about 10,000 people that we're responsible for in our prison system, and about 1,400 of those are women. Comparatively, I think we're a state of about 2 million. Think about Utah, very similar state in a lot of ways. They're a population of about 3.5 million. They incarcerate about 6,500 people, and about 450 of those are women. So you can see there sort of the direct comparison on the numbers.
As we think about incarceration here in Idaho, we also have a large number of people who are reentering society. Can you talk about those numbers?
Yes. So of the folks that we have incarcerated, roughly 97% of them will come back to the community at some point in time. So almost everybody, very small numbers of people who stay incarcerated, and those are people who are either sentenced to death or they're sentenced to life without parole as an option.
What does that mean for you and for your team as you're preparing for reentry?
It's hugely important, as you can imagine. So if we keep in mind that nearly everybody is going to be out in the community at some point in time, that helps us orient our work around answering the question, what sort of neighbor do we want to have when they come out? Because we imagine almost everyone coming back out. And so we're always thinking about what sort of interaction do you want to have with somebody who's formerly been one of our clients, right? If someone's been in prison, I hope that if they move into your neighborhood, you don't even know, because they're paying their taxes, they're taking care of their children and their families, and they're doing all the right things so they don't stand out as, oh, this person has been in prison, right? So that's sort of the mindset that we adopt when we are thinking about the types of programs we have, the reentry preparation that we do. It's all about knowing that most everybody's coming back out.
That's a really interesting mind shift. I think most people don't even think about that when they consider incarceration. So as you're preparing to serve your population, you're really thinking about serving them for reentry.
We are. I mean, because that's community safety, right? You are safer, I am safer, everybody in the community is safer when the people who have been our clients, our prisoners, whatever term you want to use, get out and integrate into society in really productive ways. We don't want to have additional victims. And so the way to think about that is, what skills, what abilities do these folks need so they can get out, be successful, do all the things we expect them to do, and not create new harm or, to the community or to victims in particular. And I think sometimes it's easy to think about our work as, oh, it's prison, so it's over there, it's out of sight, it's out of mind, they're being punished, and then magically people will come out the other side being better versions of themselves. But the reality is, a lot of the folks that we receive into our prison system, they haven't had good role models. They don't know often good decision making. They make impulsive decisions. And so all of that is the work we're trying to do to prepare them for reentry success. It's teaching them, how do you stop and think about a decision? Make sure you're making the right decision. How do you consider other people in that decision? Right. So sometimes we're really teaching people skills, maybe for the first time.
Let's talk about recidivism here in Idaho. Can you tell us maybe by the numbers, or help us understand what does that look like here in Idaho?
So recidivism in the state of Idaho has been pretty stable for the last decade or so. And we've been in the high 30%. So the most recent year, we were at 38%. What that means is, of people who are either on supervision or in our prisons and leave, get off of supervision, 38% of them return within a 3-year time period. 62% do not. 62% will go on, be successful, but you have nearly 1/3 of people returning into our system.
Is there a reason, I know we're a rural state, so there are challenges for those that are reentering society if there aren't, certain resources in their home communities, especially in rural areas. Does that play a part to recidivism numbers that you're talking about, or what challenges do you see?
Sure. Being a rural state does have some impacts, but frankly, the challenges are pretty universal across the state. Even in dense areas like here in the Treasure Valley, we may have some additional opportunities, some more programs and things that people can access, but the challenges are really the same. They just might be scaled differently. Those challenges primarily boil down to housing. People need a safe place to live. If we're going to ask them to show up at a job or at their probation parole office, for appointments, they have to also know where they're going to lay their head at night. So having stable housing that's somewhere where they can be clean and sober, making sure they can afford that. So having jobs that pay a livable wage. And then we have the added complexity that most people who engage in the criminal justice system will have some sort of addiction history. They may have mental health issues, but often they will have substance use problems in their history. And so we're looking for them to get connected to service providers for mental health, substance use, might be anger management. So we do a lot of those classes inside the prison in preparation. But when they get out into the community and start facing the real world challenges of, how do I make, this little bit of money stretch to pay my bills and pay my restitution and take care of my family, all of a sudden, those addictions and those old habits can creep back in very quickly. So those challenges exist for almost all of our population to some extent. And then it's just a matter of accessing resources. And certainly in some of the more rural communities, they just lack access to resources. So there's, fewer programs, fewer supports, fewer things you can engage in that will help keep you out of the justice system.
If you could wave your magic wand, I know we like to say that, right? And design a perfect world, but what would be the biggest support or biggest indicator of success for somebody that is reentering society, that is facing a challenge, especially as we think about these rural areas of our state?
That's a big question.
I know, right? Not fair.
Yeah, it's hard to say there's one thing, right? I think if we knew there was one thing, we would definitely do that one thing for everybody. And I think that's the nature of the challenge, is that we're talking about people, not widgets. And so each person needs something that's a little bit different. And I think finding ways to individualize the resources that we have is part of our challenge, frankly. But I think, one of the things that we talk a lot about at the Department of Correction is a bit of a mindset shift for us is we've historically, when people get out of prison and they're often on parole or maybe they're just on probation, we've often had a long list of things for them not to do, right? Don't be in places that sell or provide alcohol. Don't be around your old friends. Don't, be out after a certain curfew. We have lots of things of you not to do. We haven't done a great job telling them what to do. How do you get people? What we're looking for is for people to get out in the communities, get connected in ways where, again, they're productive members of society. So I would argue we want them to actually thrive. And the difference between getting out and complying with a whole list of rules, that's sort of baseline. But that doesn't indicate, that you've actually reintegrated, that you actually are taking care of yourself, your family, your kids, whatever. And I would like for us to get more into that space. So what does it take? I think, honestly, it takes the community being more engaged with people, being more willing to hire people who come out of incarceration, being more willing to support people, whether that's through church or civic groups, welcoming people back in so that they actually have places to get connected that are positive, that are supportive, and they don't feel like they're outcast permanently.
That's great that that you bring that up. Anywhere that there is that positive environment, that opportunity for mentorship, or even examples of what successful behavior, positive behavior can look like. Statistically, we know that employment can be one of the most successful indicators for positive reentry. You have been a huge support and proponent for an effort here in Boise that we've gotten business leaders around the table talking about second chance hiring. What could a statewide effort look like for Department of Corrections and for those that are reentering society? What could that mean for individuals and for the state collectively when we look at the numbers?
Well, I mean, honestly, I think it could be life-changing for individuals. So what we're talking about, if you really drill down onto an individual level first, you think about people who, while they're with us, they may spend years with us in prison. That's very often the case. And we have an opportunity during that time to really do some job training. We do a lot of career technical education training. We do, adult basic education training, like all sorts of things to help prepare people for jobs in the community and actually in-demand careers. And so some of the things we're talking about might be masonry, they might be computer coding, graphic design, like you name it. We probably have some kind of apprenticeship or work program that's targeting that. And that for me feels like a really natural place to connect from what's going on in the prison to what's going on in the community. So when you sort of brought together the group of business leaders, I think we just have this massive untapped workforce who have such great skills about them because they are learning cutting edge technologies and they're getting national certifications while they're incarcerated. So they're using that time productively and then are prepared to just translate that directly into work in the community. So I think for business leaders, there's just a real opportunity. I mean, we have a very low unemployment rate in the state. We have lots of growth projected with some really big companies doing massive expansions here. And we know workforce is a challenge. And so I would say we have a big opportunity to partner with business leaders who are interested in working with folks who maybe have a criminal record.
Let's talk a little bit about women's incarceration rate and why it is so high here in Idaho. Can you help us understand why we are leading the country in our incarceration rate?
I think it's a really complex answer to that question. So again, just to kind of orient people to we're at the top of the list in terms of incarcerating women across the country. I just pulled our data today actually to see what the most recent national study showed. And that's about 2 years old, so bear that in mind. But it had our incarceration rate in Idaho at, I think, 152 people per 100,000. And the national average was about 51. So you can see the difference there. Right below us is Montana. And then I think Oklahoma is kind of one of the other top states, and they've been around the top for a while. Again, I think it's really a helpful comparison to just think about the fact that we've got roughly 1,400 women incarcerated in Idaho right now, where our neighboring state of Utah has about 450. So a pretty massive difference when you think about regionally, we have a lot of similarities and just really big differences. What feeds that difference is a whole set of things. And so, I sort of sit atop the agency where we receive people and we hold them while they're, serving their term. But there's a lot of things that happen up front in terms of calls for service, arrests at the front end, charging decisions, plea agreements, sentencing. All of that happens before I ever see those folks. And so the data that I have really just tell me we're receiving a lot more people, and I can tell you what they're in for, but I can't see all of the other kind of contributing factors that lead into how they get into the system. We know, by and large, the majority of women, I have a little data sheet here, I'll just peek down, 66% of the women are in on drug charges. When we add in alcohol charges, then the number is it's about 73, 75%. So a large percentage of women come in, and that means that the most serious charge that they have is drug or alcohol related. When we hear stories about that, we hear very much the stories, and one sticks with me in particular of a woman who was sharing her own struggles with addiction and her use. And I think she was at the time a heroin user. And she ended up being caught and charged with a trafficking offense and convicted of a trafficking offense. And she said, I wasn't trafficking. She said, you have to understand, and this is something I had never thought about. She said, it's kind of like the Costco of drug buying, right? When you go to Costco and you buy a whole bunch of toilet paper at once, you get a savings. She said, it's kind of the same with buying street drugs. You buy more of them, they are cheaper. So they pool their money together, her and her boyfriend at the time. They bought more drugs. They get into thresholds which carry additional years of sentencing. That I was using drugs. I had no idea if I was over the threshold, if I was below the threshold. That wasn't part of her thinking. Her thinking was, how do I get the most drugs for the lowest price? So I think hearing that story for me, it stuck out because I think sometimes we assume that the people, that are especially struggling with addictions are really aware of the laws or the weights in the laws. And I think a lot of times they're just not. They're just not in their right minds at the time, and they're not thinking about those things.
So she was charged for trafficking, and in her mind, that hadn't even crossed her mind.
No, it was just personal use.
Yeah. So you've got high women's incarceration rate. What does reentry look like? Is it different for a lot of our female inmates than it is for the male counterparts, or is it similar? Knowing that we don't have as many women's facilities, what does that look like?
So the reentry process is largely the same for men and women right now. I would say what's different is inside prison, there are more opportunities for women to be engaged in classes and kind of mental health treatment programs that deal with some of the underlying reasons they get caught up in the justice system. And to be clear, I'm going to say, like, the women we have in our system make choices that drive, they make criminal choices, and that's what lands them in prison. But we also know that usually way back for a lot of the women we see, they have all sorts of trauma, abuse, and often they get into crime because it's a survival mechanism. And so that doesn't excuse it. I say they're still responsible adults and they make choices, and sometimes they're very bad choices. But they also have a lot of other things that kind of underpin their behavior. And so we see that for women, it's much, much higher rates, obviously, of childhood abuse, adult abuse, and that could be physical, sexual, emotional, you name it, domestic violence. Often they'll have a history where they've had repeated abuses throughout their life. And so then maybe they're using drugs to try and avoid all the feelings and all that, previous stuff in their lives. And for a while, probably using drugs was helpful for them. They probably enjoyed it. They probably had some benefit from it. But most people who are in long-term addiction, and most of the women that you talk to, they say they're working really hard to just avoid those feelings because they would be overwhelmed by them. So they have more opportunities to do things related to trauma and to try to reduce trauma, get them to address it so they're in a healthier place. So that's a little bit different. And then the rates of women who seek mental health treatment while they're incarcerated are significantly higher than men. And so we'll often have more women who come out and have kind of a mental health component to their reentry plan than we'll see with men.
So you've been now director about a year.
Yes.
You were with the department for how many years before that?
6.
6 years.
Mm-hmm.
Okay. So in the year, and knowing it's a huge ship you're steering, right?
Mm-hmm.
One of the largest state agencies in the state. What changes have we seen over this last year? What changes are your priorities? What does that look like for you as director?
So a lot of the way I approach the work and what I've tried to bring to our staff is really thinking about what the research and the data tell us. So how do we actually apply what we know is best practice, what has good evidence support? How do we ramp up those efforts? That's in things like, educational programming, rehabilitative programming. How do we tackle the actual root causes of what is getting people incarcerated and reincarcerated with us? That's some of like the trauma work we're talking about. And then how do we evaluate if we're doing things that aren't working, we need to stop them or pivot, and figure out how to make them more successful. So for me, it's really thinking about the data and what we know, and there's a lot out there, right? Corrections have been around as departments for a very long time. And then the other thing I would say is really prioritizing staff safety. Because if I feel strongly that if we take good care of staff, if we create safe facilities for staff, they will in turn create safe facilities for the people that we're asking them to supervise. And we have seen that in the past year, the number of violent episodes in our facilities has decreased, but the struggle we're really having is with addictions. It's with drugs being introduced into our facilities. So we're really trying to focus the safety effort around, first and foremost, creating safe environments for everybody who's living and working in them. So that's been kind of one of our first intentional pivots.
Which I'm sure is hugely important. We talked earlier about how, as you're looking at your responsibility as leading the Department of Corrections, each person that you're accepting into the system, preparing them for reentry, looking at the statistics, or I'm sorry, looking at the data and having that help drive that experience, and really wanting to prepare them for the utilizing that time that they are with you, the time that they are serving. How does that look like? How are you using data to ensure that you're best utilizing that time and preparing them for that moment that they're reentering society?
Well, we start by just measuring everything we can measure practically. And so we are looking at, constantly dashboards of interventions, so we can see how many people are going through programs, what do those outcomes of those related programs look like, how do we, invest and ramp up more in those spaces that we're showing success, and, again, less so in places where we just aren't seeing the same return. And so we're constantly looking at data just across the agency, I would say. It's tricky, right?
Sure.
But I will say the data, for a long time, we've said, let's be a data-driven organization.
Mm-hmm.
But what that actually means and how you operationalize that are different things than saying you want to do that. And so for us, I think the first step was really having our data team build out a whole host of dashboards where we could get very granular, very specific on things. And I mean, the variety of things that we are looking at includes everything from who's at risk to self-harm to, who is most likely to be successful in the community. And so there are literally hundreds of data points we need to watch, but you can't watch 100 data points simultaneously and act on all of them at the same time. So really, we think about each site, each warden, each community reentry center manager or district manager being responsible for in their own facility or site, really thinking about what are the important metrics for them. So they vary a little bit based on the work site itself.
I have to say that is really inspiring to hear. I know I've worked in organizations where we've had the opportunity to think about using data, kind of looking at it with a microscope rather than using it, as a hammer, and letting that data really tell the story around where there's the opportunity to turn the dial a little bit and make a difference. And I'm really inspired to hear that you're looking at it that way within your own organization and knowing that we have the opportunity to really make a difference in a place that is important.
So if I could just give one example related to how we use data, we asked and sort of challenged all of our wardens. So these are the facility heads at each of our prisons to look at the data that they could see about their facilities and really come up with a project or something to work on. And it was the managers above the wardens who they heard a lot about misconducts, or we call them disciplinary offense reports. So when somebody misbehaves in prison, they receive a disciplinary offense report. And the wardens got together and said, we're really seeing a difference in what's happening here. We're seeing, again, less violence and much more drug use. And there are some people who in our prisons they'll attempt to traffic, right? They'll kind of create businesses where they buy and sell drugs for their own gain. But then there are people who are just, might be trying to make alcohol for their own use because they really have a longstanding addiction problem. And so the wardens and their supervisors got together and said, we could handle this problem differently. So actually one of the things they've piloted this last year is making some small changes to how we handle disciplines to sort of separate, just like in the law, people who are trafficking and manufacturing drugs, hopefully they're not manufacturing, but trafficking drugs, and those people who are just using and who maybe have an addiction problem. And so we're providing, everybody's getting held accountable, but we're providing more kind of recovery supports for people who are using, and we're providing more punitive responses for those people who are clearly trying to traffic in the facilities. And what we're seeing there is it's actually disrupting recruitment to gangs. So you follow this for a second, when our historic handling of that problem would be everybody was treated the same. If you were caught with drugs, regardless of personal use, trafficking, you got the same response, which was you would be segregated. You would be in essentially a punitive placement. And that put you in direct contact with very active gang members who are often trying to recruit you in, to owe them favors, to kind of do bad work on their behalf. And we realized we were actually feeding the gang network by our punitive response to people who have addictions by splitting them out and physically moving them in housing location so we can handle them in other spaces in our facilities, and providing them essentially the treatment that they need. We can create off-ramps which help those individuals and also keep them out of the gang. So we're seeing that the activity of the gangs in our prisons is actually shrinking over the past year, which is kind of a wild success for us.
Wow, that's great.
Yeah.
And these are people, especially those that in a lot of ways talk here in Idaho with Right on Crime about second chances and second chance hiring, the opportunity to provide a second chance with the right interventions and the right support systems. And I just want to say thank you. Thank you for your leadership. Thank you for your insights and the work that you're doing, and the great responsibility that you have taken on with your leadership and leading the Department of Corrections. And thank you for joining us today in studio at Right on Crime.
Yeah, well, thank you for having me.